What if I told you that there is an infection that can silently destroy your fertility? And most people don't even know that they have this infection. By the time they notice it, it could be too late. Today, I'm going to expose the truth behind the pelvic inflammatory disease (PID). This infection affects millions of women worldwide. Welcome back to the Family Health Academy. My name is Dr. Ugwuanyi. I'm a licensed medical practitioner. I teach everything about your health. I make them practical and simple. Pelvic inflammatory disease or PID is one of the leading causes of infertility. Yet, this infection are really talked about. Today, I'm going to tell you what pelvic inflammatory disease is, how this infection can silently destroy your fertility, the warning signs you should not ignore, and how you can protect your reproductive health. Watch this video till the end because the last part is going to surprise you. What is pelvic inflammatory disease or PID? PID is an infection of the female reproductive organs, the uterus, the fallopian tube, and the ovaries. This infection results from untreated or poorly treated sexually transmitted infection like chlamydia, gonorrhea, and sometimes they can result from other bacterial infection. This infection can silently destroy your fertility. They are called silent fertility destroyer because this infection doesn't shout. Sometimes it whispers and sometimes it completely remains silent. But inside the body, they can cause scarring of the fallopian tube, the blockage of the fallopian tube, the chronic abdominal pain, ectopic pregnancy, and sometimes they make pregnancy impossible or completely not possible. So, and this is one of the reasons why many women find out that they have this infection only when they are trying to conceive. How does PID destroy fertility? When this bacteria gets into your cervix through the vagina, they enter your uterus and the fallopian tube. When this infection gets into your body will see it as an intruder or a foreign body, and they try to fight this infection by forming inflammation. In order to prevent this infection from spreading, they can lead to what we call the scar formation. So this inflammation and scar formation can damage the fallopian tube. They can cause blockage of fallopian tube. They can increase the risk of ectopic pregnancy. Ectopic pregnancy simply means that the pregnancy, in a normal pregnancy, is supposed to implant inside the uterus. This is what we call the uterus. This is the fallopian tube, and this is the ovary. Okay, so in a normal, this way after fertilization, a fertilized egg supposed to implant in uterus, but because of the damage or the blockage of this fallopian tube from this pelvic inflammatory disease, they can cause ectopic pregnancy. Ectopic pregnancy means that the pregnancy, instead of implanting in uterus, it can implant outside the uterus, especially here in fallopian tube. So this is why it is called ectopic, outside the normal area. Okay, so this inflammation can also cause irritation of nerves, thereby leading to chronic pelvic pain. So, and if this PID damages this fallopian tube, so this fallopian tube, if you damage this fallopian tube, it will become very difficult, or in short, it will become impossible to become pregnant, and the person will become infertile. And that is what the reason is this: for an egg to be fertilized. So when, let's say, when a sperm is released into the female reproductive part. They travel through the uterus to the fallopian tube. Fallopian tube is where fertilization where fertilization should occur. Fertilization simply means that when the egg combine with sperm, so it's what we call the fertilization. So and this fertilization occur in this fallopian tube. So when this fallopian tube is destroyed, for instance, by this PID, so even if there is sperm here and the egg is released, but the egg can't trap because this thing and this fallopian tube has been destroyed. And that is how it can lead to infertility. Okay. So what are the warning signs that you should never ignore? So even though this pelvic inflammatory disease can be silent, but there are some certain warning signs that you should never ignore. Number one warning sign when you are having a painful intercourse. Okay. Number two is when you are having unusual vaginal discharge. Number three is a painful period when you're having a painful or irregular period. So and number five is what we call the when you are having a mild lower abdominal pain. If you notice any of these signs, please do not treat yourself. Go straight to the hospital because early detection is very, very important in prevention of this possible complication from pelvic inflammatory disease. So how can you prevent pelvic inflammatory disease? The good news about this pelvic inflammatory disease is that it is preventable. You can prevent it by avoiding unsafe sexual practices by using of a condom, avoiding multiple sexual partner because this infection is transmitted through sexual infection or sexual means. Okay, so number three is by educating your partner and yourself about sexual health. You and your partner are supposed to know the importance of sexual health. Another way you can prevent this infection is by going for regular sexually transmitted infection screening, especially if you are sexually active. And again, you should always go for hospital when you see any of these symptoms I mentioned above because early detection can protect your fertility. I want you to remember that your fertility is in your hand. Your fertility future is in your hand. Protect it. So if you learn something from this video, don't forget to like, comment and share so that other people can see and benefit from it. If you have not subscribed, please subscribe so that you won't miss any of our video. Click the notification button. If you have any question about pelvic inflammatory disease, drop them under the comment section. I'm going to answer it. Please help me share this video because pelvic inflammatory disease has caused a lot of damage. It's still causing a lot of damage because this infection sometimes remain silent, and even when the symptoms are there, most people ignore these symptoms